Today we will discuss about Aj-Ket, our new launch product containing Ketorolac 30 mg IM IV injection. Aj-Ket or Ketorolac is a potent analgesic. Before we move further and discuss about Ketorolac, let us first discuss the mechanism of pain, how and when pain is produced and how it can be reduced. Here you can see is a cell, is a human cell. We can see four prominent parts of this cell, namely cytoplasm, nucleus, cell membrane, and mitochondria. All the organelles of the cell have their peculiar function. Cytoplasm contains all the cell structures intact in their position. Nucleus is the brain of the cell. Cell membrane keeps the integrity of the cell and protects it from the outer environment. Mitochondria, as people know, is the powerhouse of the cell and produces energy. So what happens when cell injury or tissue injury takes place? Whenever there is a cell injury, the cell membrane is ruptured. When the cell membrane is ruptured, the component of the cell membrane, which are mostly phospholipids, they are released. They are released how? Phospholipids are released by the action of phospholipase enzyme, and those enzymes convert phospholipids to arachidonic acid. Once those arachidonic acids are produced, once those arachidonic acid is produced, a series of reactions starts. What happens then? After the arachidonic acid is produced, there are two enzymes which can act upon arachidonic acid and produce respective chemicals. When cyclooxygenase 1 acts upon arachidonic acid, it produces those prostaglandins which are helpful for the body and produces gastric protection enzymes, helps in homeostasis and helps maintain renal function. When cyclooxygenase 2 acts on arachidonic acid, it produces those prostaglandins which produces pain and inflammation. So if we want to reduce pain and inflammation, we have to inhibit this cyclooxygenase enzyme. So what is pain then? This chain reaction produces pain, in which arachidonic acid is acted upon by different enzymes which convert arachidonic acid into prostaglandins, which initiates pain and inflammation in the body. So what do we got to do now? We have to break this chain of pain. But how to break this chain of pain? We can do this by using Aj-Ket Ketorolac in intramuscular or in intravenous form. So this is the solution on how we can inhibit or reduce pain. So let us discuss about Aj-Ket. We will discuss here two major characteristics of our drug, namely pharmacodynamics and pharmacokinetics. In pharmacodynamics, we will discuss about the mode of action. So here you can see the ketorolac, like other NSAIDs, like other non-steroidal anti-inflammatory drugs, exhibits analgesic activity. The mechanism of action of ketorolac, like other NSAIDs, is by inhibiting cyclooxygenase enzyme. This is the same picture below here, where you can see that NSAIDs or cyclooxygenase inhibitors, they inhibit cyclooxygenase 1 and 2, and by inhibiting cyclooxygenase, arachidonic acid is not converted to prostaglandins, which cannot produce pain and inflammation inside the body. So this way we can reduce the sensation of pain inside the body. So this is the mode of action of ketorolac. Now let us discuss about the pharmacokinetics. In pharmacokinetics, we will discuss four parameters, namely absorption, distribution, metabolism, and elimination. So let us discuss about absorption. Ketorolac is available in intramuscular and IV dosage form, and ketorolac has linear pharmacokinetics in adults following single or multiple IM or IV doses. This means that by increasing the dose, there will be an increase in the concentration of both the free drug and the plasma protein bound drug. So ketorolac has linear pharmacokinetic profile. Talking about the distribution, the mean apparent volume of distribution of ketorolac is 13 liters. Ketorolac is very highly bound to protein. 99% of the drug is bound to plasma protein, which is albumin. And if we decrease the serum albumin concentration, definitely there will be an increase in the uh, free ketorolac concentration. Ketorolac is excreted in human milk, so shall not be used by lactating women. Talking about metabolism, ketorolac is largely metabolized in the liver by cytochrome P450 enzyme system. The products of metabolism and some unchanged drug are excreted in the urine mainly. Uh, let, let us discuss about excretion. The principal route of elimination of ketorolac and its metabolites is renal. Almost 92% of the drug is excreted through renal route or through urine. Uh, Approximately 40% as metabolites and 60% as unchanged ketorolac. Approximately 6% of the drug is excreted in the feces. 92% of the drug is excreted through urine and 6% of the drug is excreted through feces. Half-life of ketorolac is 5 to 6 hours. Let us discuss about the indications and usage. Ketorolac is indicated for the short-term, less than 5 days, management of moderately severe acute pain, usually in post-operative settings. The total duration of use of ketorolac is not to exceed 5 days of use. Remember, ketorolac is only for acute pain reduction, not for chronic or long-term use. So it shall be used in acute pain in adult patients. Ketorolac can be used concomitantly with opioid analgesics, but remember it shall not be co-administered in the same syringe. They can be co-administered together but not in the same syringe. Different syringes must be used. Then it can be used in dental extraction pain to avoid severe painful conditions and in renal colic also, where moderate to severe pain is observed in patients. Dosage of ketorolac is, we can use ketorolac in IV, through IV route or through intramuscular route. Through intravenous route, one IV dose of 30 mg in patients with age less than 65 years and one IV dose of 15 mg in patients with age more than 65 years and weight less than 50 kg. Through intramuscular use, 1 IM dose of 60 mg in patients with age less than 65 years must be used, and in patients with age more than 65 year and weight less than 50 kg, 1 dose of 30 mg must be used. Let us discuss about the contraindications of ketorolac. Ketorolac is contraindicated in patients with previously demonstrated hypersensitivity to ketorolac. If a patient is hypersensitive to ketorolac, it must not be used in those patients. If patient have active peptic ulcer disease, for sure it must not be used in those patients as well. In patients with recent gastrointestinal bleeding or perforation and in patients with a history of peptic ulcer disease, contraindicated. In patients who have experienced asthma, urticaria or allergic type reaction after taking aspirin or other NSAIDs, this ketorolac is contraindicated in those patients because it is also a non-steroidal anti-inflammatory drug like aspirin, so it shall not be used in those cases. It shall also not to be used as prophylactic analgesic before any major surgery. It shall also be not to be used in perioperative pain like during surgery. It shall not be used. Ketorolac is contraindicated in patients with advanced renal impairment because this drug is excreted through renal route. So if a patient who is renally impaired, this drug is contraindicated in that patient. It shall not be used in labor and delivery. It shall also not to be used in patients who are suspected or confirmed cerebrovascular bleeding, hemorrhagic diathesis, incomplete hemostasis, and those at high risk of bleeding. It shall also not to be used in patients who are receiving aspirin or any other NSAIDs. Uh, Ketorolac shall not be used with probenecid and pentoxifylline, and it shall not be administered through neuraxial route in like epidural or intrathecal because it contains alcoholic contents. Let us discuss about the warnings and pregnancy category. The total combined duration of use of oral ketorolac and IV or IM dosing of ketorolac is not to exceed 5 days in adults. The only warning regarding ketorolac use is the use of ketorolac shall not to exceed 5 days. It is only, as we have discussed earlier, it is only for acute pain, not for chronic pains or long term use. So ketorolac shall not be used in any patient for more than 5 years. And ketorolac is also not suitable for pediatric patients. It shall only be used in adult population. Pregnancy category of ketorolac is pregnancy category C, so it shall not be used in pregnant women. So this was all about the pharmacodynamics and pharmacokinetics. Stay tuned for literature discussion. That video is coming soon.